McCarty, KIRO 7 News.
In the midst of a measles outbreak in southern Washington, state legislators introduced a bill that would eliminate personal exemptions for the MMR vaccine, which is meant to prevent measles. Clark County has one of the lowest immunization rates in the state. Statewide, 88% of school-age kids are vaccinated, which is below the federal recommendation of 90%. KIRO 7 South Sound Bureau reporter Shelby Miller is live in Olympia, where she spoke with the bill's sponsor and those who strongly oppose it. Shelby?
Health officials now say there are 36 confirmed cases of the measles in our state. The bill's sponsor says having the mandatory vaccine for school-age kids will help keep them safe. But people who oppose this bill says that's the parents' decision. Washington's under a statewide public health emergency. Measles cases continue to rack up. Doctors say the majority of sick children weren't immunized. State Representative Paul Harris says something needs to be done.
To be quite frank, we should get rid of all personal exemptions for all vaccines.
He just introduced House Bill 1638. It would eliminate the personal objection that currently allows students to go to school without the MMR vaccine.
We are one of only 18 states that has a personal exemption left. So the vast majority of the United States, you do not get a personal exemption.
The State Department of Health says there were more than 41,000 personal immunization exemptions last school year. About 33,000 students didn't get the MMR vaccine. Doctors say the vaccine is 97% effective and provides immunity for life.
We know that this disease, this outbreak, is completely preventable, and we have people in our communities that are incredibly susceptible to not only this but other diseases who are not protected because of the high number of people who are not vaccinated.
Bernadette Pager is with Informed Choice Washington. She says the MMR vaccine puts kids in danger.
This bill takes away our freedom and says that you have to take this flawed product or your kid can't go to school. That is so wrong.
She says her child had severe reactions to vaccines as an infant. She believes they're not safe and wants parents to have a choice.
We're never going to give up. This is my life's mission now. You know, Mama Bear, you get an injured child.
Children with medical and religious reasoning could still be excused from this vaccine. A similar bill that aimed to get rid of the personal objection for all vaccines did fail in our state a few years back. Reporting live in Olympia, Shelby Miller, KIRO 7 News.
Washington is under a state of emergency as measles cases continue to grow. Good evening and thanks for joining us. I'm David Rose.
And I'm Marnie Hughes. There are now 35 confirmed cases of the measles in Clark County, and there is one case in King County. 25 of those people are 10 years old or younger, and at least 31 of the 36 cases confirmed with the measles were not vaccinated.
My biggest concern is the numbers increase, that we lose a child to this disease, and something that is completely, utterly preventable.
The Clark County Public Health Director says we could likely see more cases well into the month of February. Doctors call the measles one, if not the most contagious viral infection out there. So the messages tonight is get vaccinated, because as Hannah Kim is about to show you, nothing else will protect you.
So the red are the counties that would be of most concern.
With a measles outbreak declared a state of an emergency, state health experts like Daniel Koenig are feverishly working to contain the viral illness.
Measles is so contagious that if you're not immunized against it, you will almost for sure get it if you are exposed to someone who has the disease.
The state health department says the reason for the growing number of measles cases is directly correlated to the unvaccinated population.
We want everybody to be at 95% coverage or higher. So anytime you fall below that 95% coverage level, then diseases can spread a lot more easily.
Clark County, the heart of the outbreak, has a vaccination rate of only 84.5% for kindergartners when it comes to the measles. Counties like King, Snohomish, and Pierce counties are just over 90%.
There are people who are resistant to getting vaccinated.
If you look nationwide, Washington state's vaccination rates for measles are on the lower end of the spectrum. This CDC map here shows the most vaccinated states in black, the least in white. When it comes to toddlers, states like Virginia, for example, has a 97.6% 86% vaccination rate. Washington State is at 88.5%.
Some of the challenges in Washington State is we do have a lot of rural communities that may have access issues. They may not be opposed to vaccines, but they may just have trouble getting to a doctor.
But for those who are choosing not to vaccinate their kids, one state lawmaker is trying to change that. There's a House bill that aims to take personal exemptions off the table for families who send their kids to public schools. The bill is only targeting the measles.
There are 18 states, only 18 now, that still allow personal exemptions. So we're by far in the minority. Many state courts have weighed in that the right to practice religion or the right to choose does not include the liberty to expose a community or a child to a disease.
The death rate for the measles is low, but that is not what health experts are most worried about. The serious complications is what they're most concerned about with the measles, things like neurological problems, deafness, also your immune system could be compromised years after a person has recovered from the measles virus.
Obviously, the message there is to vaccinate, but how complicated is the process? There's more than one shot, right?
So there's 2 shots. It's the MMR vaccine, which stands for measles, mumps, and rubella. Kids usually get that first shot at 12 months, then they get the second shot between 4 and 6 years old. So typically by the time they head to kindergarten, they've had both shots. They say if you have had both those shots, the booster and the vaccine, you are 97% protected when the measles is spread through the community. So they're saying that is the best defense tonight.
Yeah, and you can have it done again. If your parents don't know, or they're not alive, or you don't know if you were vaccinated, you can do it again.
You can get the shot twice, correct.